Happy Sunday, happy Labor Day. This is TFCC Sunday. I'm going to wait for a minute for people to join. Today we're talking about the weight-bearing test. And I want to kind of share with you where the weight-bearing test came from. There's a lot of people that have a TFCC tear and they don't have access to physicians or MRIs or x-rays. There's more people in that situation than not. And so I wanted to have a tool for people to act that's accessible, that's affordable, that people could use to measure their weight-bearing tolerance and the state of their TFCC. And this kind of happened by accident with one patient, and it became really valuable over the course of time. And I came to understand kind of what normal weight bearing is in the adult human population, what happens when somebody has pain and when you put a WristWidget or tape on, what happens if somebody has pain and there's no change with tape. And so many years of since 2006, this has been all I do. So I want to accentuate the value of a non-digital scale. It's something that's affordable, it's available anywhere, it has to be non-digital, it's just a spring inside the scale. It's a really wonderful tool. So the next question is, so the MRIs, having to wait for an MRI is common, and then you've got to go back to your doctor and have it reviewed, and the MRIs are not very reliable with regards to the TFCC. So these are reasons why the scale is really important. So what do? You take your hand. First, let me just explain a couple things. First is there's no difference between dominant and non-dominant wrists. They should be the same. The ability to bear weight through your wrist is based on age and height and bone density. So if you're smaller and younger versus young and the same height, your weight bearing should be about the same. If you're two people, 65 years old, no significant medical history, age and height are the same, weight bearing should be the same. You have a beautiful control, which is your uninjured wrist. There are people that have really low weight bearing tolerance bilaterally, and usually those have a autoimmune or a bone density issue. So here's the scale. So what you do is you place your hand on the scale, fingers facing the 0, and you make sure your elbow is straight. Now, if the table is high, you can't get your elbow straight. So don't do it on a table that's high. Do it on a table or the floor that is, you can get your elbow straight. And you're just lean over it and put your body weight through it to generate that high weight bearing. Now, you're not going to be able to get and hold 100% for a long time. It's going to go up and then drop back down. Most people can hold about 40 pounds, 45 pounds fairly consistently, but it still wiggles a little bit. So you go up to a height and then it drops back down. And position of the hand is important. Position of the elbow is important. You don't want your elbow to be bent. You don't want your wrist to be turned. Either way, you want it to be nice and straight, and you want to be able to push down through your shoulder, through your elbow, through a straight elbow, and push down like that. Now, there are people that have wrist fractures or, a wide variety of things where going into full wrist extension is difficult. That's okay. You can do the same test at an angle. So what that looks like is this. Your hand is flat and you're at an angle, and you push down as much as you can. And you'll drop your weight bearing tolerance. In a normal wrist, it'll drop about 20-30%. But you've got your other wrist as a control. Now, should you do it seated? No. You should do it standing? Yes. Palms should be placed flat, not rotated. The other question that I get is, what is the difference between large and small, male and female? Okay. If you are a 21-year-old, 6-foot male, you're going to have really high weight-bearing tolerance, more than women. As you go through age, that same 6-foot male, the weight bearing is going to drop. And if you go to the website and you look at the research that was published on normal weight bearing in the adult human wrist, you'll see a really reliable and predictable scale that says if you're tall, it's up here. If you're shorter, it's down here. The average weight bearing tolerance in the adult human wrist is 60 to 65 pounds. Now, I have the highest weight bearing I've ever witnessed is 140, and that was in an elite tall athlete. I don't see a lot of above that. I did notice that in the Asian population, the weight bearing is lower because they're smaller, and in the Norwegian population and German populations where they're really high, you have higher weight bearing tolerance. So there's height and age matter. The next question is, what happens if I'm below 60 pounds on both wrists? Good question. I recommend having a DEXA scan and look at bone density, particularly if you're female and you're over the age of 50, because there's some things that you can do to improve your bone density. Interestingly, weight-bearing exercises will help that, but also there's a calcium issue and hormone issue. I do see weight-bearing numbers low in people that have autoimmune, so rheumatoid arthritis or lupus or Ehlers-Danlos syndrome, which is a connective tissue disorder. I wouldn't worry too much if it's low. I would be curious about it, but that's just your... now, if you're a 6-foot person, male, 21, and your weight bearing's under 60 pounds, I'd be concerned. That's a clue to look further. All right, any other questions? Does anybody have any questions? So first step is get a non-digital scale. If you have ulnar side of wrist pain, get a non-digital scale. Test your weight-bearing tolerance in a standing position, elbow straight. Do both wrists. Find out what your normal is. Next, tape the wrist like the WristWidget with non-elastic tape on either side and test both wrists. In a normal, uninjured wrist, the weight bearing should go down 10%. So for my wrist that's not been injured, if I put a WristWidget on, my weight bearing actually goes down. So the only time that the weight bearing improves and goes up in the wrist is if there is a TFCC tear, period. So it's a really, really wonderful tool. Remember, the numbers, what you want to do first is define your normal. So 60, 70, some people are 120. If your normal weight bearing is 120 and you can only bear 60 pounds on it, you've got a bad injury. You're 100% from normal. So you may be functional and loadable, but you may not be where you should be, which is normal. Okay, so get a non-digital scale, measure both wrists, compare it with tape or the WristWidget, write it down on a log, and then see how much it improves with the WristWidget on. If it improves a lot, and a lot is anything over 7 pounds. 7 pounds is significant. A couple pounds is there's a variation in the test. You could be that's a plus negative variation. So if I were to go do it, I would get about the same every time with a plus negative 3 pound difference. So and then monitor it over the course of time. And what you'll notice is you have a objective tool now to see where you're at. Okay, any other questions? Thank you, Ashnawera. Thank you. Also, let's see. Pressing the scale, seated or standing, WristWidget position, elbow and wrist. Send us all your questions. We're here to answer them. The Facebook group is a wonderful place to talk with others. Send me, if you have your MRI and an X-ray and weight-bearing numbers, send me that data. We're starting to enroll people in a study that we're running on weight-bearing and MRIs. Let's see, I think that's it. Come on, we've got to have more questions. Waiting to see a surgeon is Sarah, there's a lot you can do now. There's a lot you can do now to help yourself understand what your wrist stability is. And a scale is a lot cheaper, faster, and more objective. So you can do that now and get some good numbers on where you're at. I'm really spent a lot of time articulating a protocol, and a protocol that's objective. So how bad is your wrist? Is it a mild tear, a moderate tear, or a severe tear? And that's important to know. And is it essential versus a peripheral? And what can you do in any of those situations? So get a scale. Borrow one. Do the test at the store. If you don't have enough money to get a scale, then test yourself at the store. Just put it on the ground in the box and measure it. So there's tools that you have that you can use to understand what's going on in your wrist. X-rays, of course, are helpful. MRI will rule out other things which are important, but I don't rely too much on MRIs because of the variability. We are going to be going over MRI interpretation in normal human wrists this coming week, so stay tuned for that. And what that is basically is that if you take 100 people that have had MRIs, and these are all people that do not have ulnar-sided wrist pain, their wrists are functional. What you find is in that group of people, there are MRIs that come up positive for TFCC tears. So it just further confuses the reliability and functionality of an MRI. It's a wonderful technology. It's an expensive technology. It's only available to very few people on the planet. And it's not a great tool to measure objectively the stability of your wrist. Yes, okay. Got it. When you quote pounds and different severity products, should I read that as a percentage of my good wrist? Yay, my good wrist is only 60 pounds. SMONK14. Your good wrist is 60 pounds. Okay, this question comes up. Okay, so let's say you've got, without the WristWidget, you place your hand on the scale, your uninjured wrist is 60 pounds. Great. Your injured wrist is 40. So if you put the WristWidget on and it moves it up to 60, you're still, 40 is how you define your severity of injury. 40 would be a moderate tear. 40 right on the cusp of functional and non-functional. So if you're at 20, it would be a severe tear. If you're at 50, it's a moderate tear. If your other one is at 60, you're okay. I would, in your case, can you tell me what your height is and your age? I don't know if you want to share that, but I'd be curious if you put the WristWidget on your uninjured wrist, if that would go up. People that are on the fence line, So they're between 40 and 50, or they're between 60 and 70. These are gray areas that are a little bit harder, because 65 pounds is a loadable wrist, which means you can load in supination, you can load a 5-pound weight. So it's a loadable wrist. A 45-pound weight-bearing number is a functional wrist, which means you can function pretty much around the house. You can drive, you can get dressed, you can cook, you can do light cleaning, basic functional tasks. 60 is that loadable wrist. So, yeah. Regardless, under 45 is a non-functional. 45 to 60 is a functional. 60 and beyond is a loadable. So, and those also are your definitions of mild, moderate, and severe. If you can load your wrist but it hurts, it's a mild tear. If you can't load your wrist but you can use it, it's a moderate tear. If it's under 45, you're having a hard time with function, that's a severe tear. It took a long time to articulate that. That was a lot of words. So that is very clear, very clear. People who are below 45, they complain of having problems with just doors and cooking and dishes and holding a cup, holding a plate, things like that. All right, any other questions? Yeah, okay, all right, okay. So for you, I would wonder about your height and your age. So yeah, you're in this gray area where you're just loadable. So first thing I would do at 58, have you been through menopause and how's your bone density? And that's kind of a standard test that we should do if we can. It's a DEXA scan to measure bone density. I would probably have that done to make sure that you're not losing any calcium as we get older, which is something that happens in women and starts at around 58. So yeah, so I would probably, do that as part of your annual physical, and also help understand kind of what your baseline is. Yeah, good. But 60's good. 60's good. You've got a nice, good wrist. I mean, I've seen women particularly who are in the shorter, below 5'2" range that have 35 because they're going through their bone density issues. And there's things you can do for bone density, and when they're done, it's really interesting to watch them improve, even though they may be smaller and older. So it's good to know. Yeah, I recommend doing it once a week, and it's important. I think it's really important to understand what your weight bearing is when you're treating it, because it gives you an idea of what you can and can't do. So, for instance, let's say you start at 30. You're supposed to be protecting your wrist. You shouldn't be loading it. You should be really careful with function. You have an unstable wrist. You should be protecting it and taking care of it. Red alert, take care of it. Once you get to 45, you should take a little bit of a deep breath. That's a huge landmark. And you can start using it more functionally without any protective devices. No over-the-counter wrist splint. You've got the WristWidget on. You can start using it around the house. And then when you hit that next landmark, next week later it goes up to 52, and then the next week later it goes to 60, then you can start doing some loading so you can pick heavier things up. You're moving out of the protective phase, out of the functional phase, and into the loadable phase. So I recommend once a week. Some people, if they're starting really low, so they're starting at 20, 30, they tend to plateau for a couple of weeks. That's important, and that's good to know. You plateau for a couple of weeks, and then it goes from 50 and it starts to move up. Remember, it needs time. Lots of time. You gotta squeeze those two bones, hold that together for a period of time, stop irritating it, stop loading it, go through the protocol, and off you go. Any other questions? Let's see. Yeah, the difference between large wrists and small wrists tends to be a topic, but remember, it's all based on height and age, not circumference of your wrist. And we see this in gymnasts. Gymnasts have a very interesting display of weight-bearing tolerance relative to their height. In general, gymnasts are smaller, and yet because they're weight-bearing a lot, their weight-bearing numbers are a lot higher relative to their height and their age. Some people who are really tall have autoimmune problems, and their weight-bearing tolerance is lower relative to their height and age, but in general, it's based on age and height and bone density. All right. The main thing on the weight bearing is that your wrist is not rotated and that your elbow is straight. And I also want to just take a moment and show you a couple of things that are worth looking at when you do your weight bearing test. So, okay. What's interesting is if you just place your hand flat, you can, and don't move your wrist, you can move your elbow quite a bit. And this, what you can play with is if you got your elbow rotated like this and you put weight. Does it change then if you put your elbow, you rotate that in, and you put here? There is a little bit of change in it. But the main thing is that your elbow is straight. It's not bent. All right. I think that's it for today. Yeah, I think I've answered all the questions. Aw. All right, I think I've answered all the questions that have come up. Just remember, this is your best friend. $10. Go get one if you have ulnar side of wrist pain. Get to know what your stability is. Get to know how bad your, how injured your TFCC is, and send us questions. Oh, okay, Lisa. Okay, all right, Lisa. So, first thing is weight-bearing tolerance. This is what we're going over today. I'll try to give you a skinny. Non-digital scale. Can't use a digital scale. Need a non-digital scale. Available everywhere on the planet. A simple tool, easy, affordable. First step is to measure your weight-bearing tolerance on both wrists. Pain-free. Do not exceed pain. Push down. Place your hand flat, not rotated this way, not rotated that way. Straight, so that the long fingers facing the zero. Calibrate the scale. Calibrate it so it's at 0. Place your hand flat. Put your elbow straight and lean into it. Test stop when it's painful. Mark the amount of weight you can tolerate. Test your other wrist. Don't do it seated, do it standing. You can do it on a table, you can do it on the floor. Wherever you choose to do it, that's where you're going to continue to do it on a weekly basis. Once you get it without any sort of tape, then you're going to do it with the WristWidget or with non-elastic tape. That non-elastic tape you're going to retest, and if it goes up, then we know your TFCC is involved. Where you start, so if it hurts at 30 pounds, that tells you that your injury is significant or severe. If it's between 45 and 60, it's moderate, and if it's over 60, it's mild. And you follow the protocol accordingly. 40s, so healthy wrists, yeah, is in the 40s. Weight bearing is based on age and height. It should be no difference between dominant and non-dominant, right and left. So Lisa, I would check and see what your uninjured wrist is. If that's 40, if they're both 40, if your weight bearing tolerance in both wrists are below 60 pounds, you want to include in part of your annual physical, if you can, some blood work and a DEXA scan. Tell me, Lisa, what's your age? Take a look at the research that we did on normal weight-bearing tolerance in the adult human wrist. And it gives you age and height changes. It goes down as we get older. Yeah. Lisa, will you please send me, okay, so first thing I always look for if you're weight bearing and bilateral wrist is low. First thing I make sure you're doing the test right and you've got a good non-digital scale. Yeah. Second thing, I do both wrists and get your age and your height. And if they're both below 60 pounds, and you're below age 65, I go right to systemic. I look at, and we've seen this, so we kind of know what to look for. But autoimmune, bone density issues, calcium, potassium, magnesium. There's a lot of other things that we look for, but they're very rare, so I don't want to alarm anybody. But, we want to understand why your stability in your wrist is below 4, is at 40. The 40 pounds of wrist stability is, it's out of the range. And I see people out of the range. I've looked at a lot of weight-bearing numbers. So there are people that have extremely high for their age and height, and there are people that have low, and those are outliers. And those, gymnasts are a good example of an outlier. They have really high weight-bearing numbers based on their age and height. So they're an outlier. Elite athletes are outliers, where they're loading the wrist regularly over the course of time, and they tend to have higher weight-bearing numbers. So there are outliers, but most fall within a range, and 90% of them fall within a range, probably more. It's predictable, it's reliable. It's been I've gathered so much weight-bearing numbers. I know what the ranges are. Okay, so your weight-bearing, to define if your weight-bearing is low based on a TFCC tear, you tape the wrist, just like the WristWidget, nothing on the ulnar head, one on either side, and retest it. And if your weight bearing goes up, we know that the TFCC is involved. If the weight bearing doesn't go up, and Lisa, you may want to try this and see if your weight bearing goes up, and how much does it go up with a non-elastic tape or the WristWidget. Lisa, will you send me an email, please? I want to look at your wrist. Yeah. So, again, the weight-bearing test is a beautiful tool. It's cheap, it's available to everybody. It helps you understand the stability of the wrist in an objective number. It helps you. Now you can watch it over the course of time. You can add a treatment and see how it affects it. You can measure what your normal is. These are information that you cannot get from an x-ray. You cannot get this from an MRI. You can't get this from a clinical exam. It's based on pounds, kilograms, normal, injured, what is the effectiveness of a certain treatment, how does it change over the course of time. Yeah. All right, any other questions? I know we've got some late joiners. I hope I answered these questions clearly. Otherwise, We're here to help, so you can email us any questions that you have. We've got that group that's on Facebook. That's, I think, 3,500 brand. It doesn't matter the brand. The brand is irrelevant. They're all manufactured the same. It's using a spring. They run between $8 and $12. You can get them depending on where you're at. They're available everywhere I've been. I've been able to, in some of the most remote places that I've been, you can always find a scale, a non-digital scale. The digital ones are more popular, and it seems like the non-digital are a little bit harder to find, but you can still find them in some form all over the planet. Doesn't matter, just a non-digital analog scale. Yeah. Yeah, okay, Lisa, yeah. Love to chat with you. Yeah. Yeah, non-digital. Yep. I think that's it. Oh, I'm so glad. I'm so glad. It's nice to meet you. And non-digital analog scale. Thank you, Glenn. Thank you, Glenn. Send us any questions. Join our group. I'm hoping you guys, this is helpful for people with TFCC tears, and I appreciate you very much. Have a wonderful weekend. Enjoy your Labor Day. And for everybody else around the world, stay safe and healthy, and we'll see you again soon. Bye.